The co-founder of BioNTech, Professor Ugur Sahin, has shown a ray of hope in this coronavirus-wrecked world. Sahin has said that the impact of the BioNTech and Pfizer vaccine candidate will start showing results by 2021 summer, and normalcy could return by the winter season next year. He also claimed that the potential vaccine will cut the transmission rate by half, resulting in a dramatic reduction in cases.
This winter will be hard, so we will not have a big impact on the infection numbers with our vaccine in this winter. If everything continues to go well, we will start to deliver the vaccine end of this year, beginning next year. The bigger impact will happen until summer. The summer will help us anyway, because the infection rate will go down in summer. And what is absolutely essential is that we get a high vaccination rate.
Just last week, BioNTech and co-developers Pfizer said that preliminary analysis showed that their vaccine could prevent more than 90% of the people from contracting COVID-19. More than 43,000 people have taken part in the tests so far. The United Kingdom is expected to get 10 million doses of this vaccine by the end of next month, with a further 30 million doses already ordered. The jab, which was trialled in 6 countries, is given in 2 doses, 3 weeks apart. It is not known yet how long immunity would last after the second dose of the vaccine is administered. Older residents and staff in care homes are likely to be prioritized, followed by health workers. After that, people are likely to be vaccinated according to their age. The co-founder of BioNTech also said that the key side effects of the vaccine seen so far were a mild to moderate pain in the injection site for a few days, and some participants had a mild to moderate fever over a similar period. And joining us live on the broadcast this minute is the virologist at the Hebrew University of Jerusalem, Professor Amos Paner. Thanks very much, Professor, for speaking with us. Your reaction and assessment of the positive information that's coming in regarding the COVID-19 vaccine development and the Pfizer candidate emerging as one of the main contenders.
Yeah, this is a good news. Actually, it's the best news since January last year, since we know now that we can overcome this pandemic. The results of Pfizer are amazing, 90% protection. First, expectations were that the vaccine at the most will give 50% protection, and here we get a vaccine which gives us 90% protection. So this is a very good result, and definitely within the next few months there will be many more vaccines coming out, and the likelihood that they will give the same level of protection or even higher level of protection. So we can anticipate now that within a year, if we can produce 7-8 milliard doses of vaccine, we can get rid of the pandemic all around the world. I know that India also is producing a lot of vaccines. Israel is producing vaccines. So many countries will start coming out with their own vaccines. And so in a matter of a year, we are likely to get vaccinated all over the world.
Right, but Professor, at the same time, there have been indications of side effects. Those who were undergoing those trials for the Pfizer vaccine candidate as well have spoken about the side effects ranging from fever, headache, body ache, comparing it to severe hangover in some cases. How concerned should we be about these side effects that have been reported?
Yeah, actually, Pfizer has taken a very new approach to produce vaccination. They are taking the virus information, the virus genetic information, and they are just injecting it into the patient, into the vaccinee. So we don't know much about this mode of vaccination. What we know is the results from 30,000 people who were vaccinated already. And according to their data, the vaccine produced some mild side effects like fever for one day, rash, and some pain in the muscle where the vaccine is injected. But really, we don't know what will happen when millions of people will be vaccinated, especially older population, or people with other problems, medical problems. And we will have to see as we go along what are the more serious side effects. But so far, the information that we have is that we can pretty safely say that it is a safe vaccine. And I hope that it will turn out to be like that. I should add that more vaccines are coming out very soon, which are based on more traditional ways of producing vaccines. And we know much more about these vaccines in terms of safety. So by April or May, we are likely to get some 5 to 10 different vaccines. And then the problem will come, what is a safe vaccine? If we have 5 vaccines to choose from, what kind of vaccine should we choose? And it's going to be not easy, not quite difficult to decide, early summer, what type of vaccines should we take? There will be a variety of vaccines, and it's interesting to see what will come out and who will be the winner in terms of safety.
Right, and that's just one part of the struggle to beat COVID-19. The other race we're talking about is the one to actually ensure that each and every individual across the world gets vaccinated. Half the doses have already been bought by rich countries across the world. There's the other struggle to ensure that the lesser developed countries also get their share and get their hands on this vaccine. Who will get the vaccine first, the priorities, your comments on that?
Yeah, and I should add that this vaccine, the Pfizer vaccine, needs a cooling at very low temperature. It's unstable and it requires deep freezing in order to pass from one country to the next, and not all countries may have this type of vaccine and this type of technology.
All right, we're going to leave it there for the moment. Professor, thanks very much for joining us on the broadcast with those perspectives on the COVID-19 vaccine.